So when patients first arrive in the anesthetic room, they will obviously be prepared to have an anesthetic. So we have not just ourselves as anaesthetists, but we have our operating department practitioner who will be helping us to put the patient off to sleep. So it's an important part of the patient's journey that it's not just having the operation, but of course starting off the anesthetic in here before they then go into theatre to receive the operation. So it does depend on what sort of operation the patient is going to receive, but usually we will put in an intravenous line into one of the veins, normally in the arms of the patient, so that they can receive the anesthetic, an injectable anesthetic, which is the smoothest way of drifting them off to sleep. Sometimes for the more major operations, we will put in other lines like central lines and also arterial lines as well. So it does depend on the nature of the operation. So the anaesthetist works as part of the team for patients having the operation. My main role, of course, is to ensure that the patient goes off to sleep and gets woken up again at the end, of course. We are there to ensure that they are monitored and they have all their vital signs looked at very carefully to ensure that they are given the best opportunity to have the operation successfully, but in a safe manner as well. So I guess the anaesthetist is not normally talked about much because most patients think, oh yes, it's just a surgeon doing the operation. But actually, like I said, it's not just the anaesthetist, but my ODP and also the rest of the theatre team will be helping us to ensure that we look after the patients carefully, not just for the operation, but also their care after the operation.